Before I give the opportunity to conference participants to address the conference, let me give now the floor to the last speaker on our panel, Mr. Kwabena Osei-Danquah, the UNFPA Executive Coordinator of the ICPD Beyond 2014 Secretariat, to take the floor for a brief overview on the ICPD Beyond 2014 review process and the global survey results. Kwabena, the floor is yours.
Thank you very much, Mr. Chairman. Good morning, everyone. I would like to begin by giving a background to the ICPD review, to put it in context. The General Assembly resolution that the Chair mentioned at the beginning of this meeting, 65234, requested a number of things. And essentially, it was to lead to the highest quality analysis of the state of population and development based on the highest quality data. It was to look at new and emerging issues and also to take into account new and changing development environment, and more critically, in terms of the post-2015 development agenda, to integrate population and development issues into the global development processes. And the goal then would be to produce a global report which would be accompanied by a shorter summary by the Secretary General, and both documents will go to the CPD and the General Assembly Special Session, which Werner mentioned in his presentation. Now, a number of objectives were then considered in designing the global survey for the review. The global survey of the review is the primary basis for the collection of the data and for the analysis for the review process. Of course, we also have the global thematic conferences, and there was reference made by our colleagues from the youth groups with regard to the Bali Global Youth Forum. We also plan to have a conference, a thematic conference on human rights. We would have another one on women's health, and the final one will be on indicators and monitoring framework. Now, all these global thematic conferences are intended to contribute additional information and analysis to support the review process. Now, in the presentations that were made earlier, we had some of the key areas of the review, so I'm not going to go into it. But I want to show you the process that led to the design of the global survey instruments. And this was a process that involved the entire UN system, academia in many parts of the world, and civil society globally. And so a lot of thought went into the design of the global survey instruments. And the idea, again, was to contribute to the General Assembly request for the highest quality data, based on which we would then come up with the analysis. And I should mention that In fact, the thinking around the global survey also involved the UN member states, and I would like to thank your countries for their contribution in sharing perspectives on how to improve the design of the questionnaire. Now, I am not going to go into the questionnaire outline, but I just want to show you the country implementation profile, which was prepared for each country based on a selection of indicators. And in the next slide, you can compare the indicators that were reflected in the country implementation profiles with the MDG indicators, for instance. And you see the substantial numbers of the indicators that were used to design the country implementation profiles. And I think one of the points that has to be made, the questionnaire came to, I believe, 83 pages. It's one of the most extensive questionnaires ever designed in the UN system. And I know that member states were a bit uncomfortable to be landed with such a long questionnaire. But in fact, countries were, and their civil society partners did an excellent job in responding. So we came out of the process with very rich body of information and data upon which the analysis was conducted. We had responses from 176 countries, as well as 7 territories and areas, coming to a total of 183 responses, which again is something that we can be proud of, because it enabled us to comprehensively cover the entire 5 regions of the world. Now, I will go into the findings. And I think the first point that we wanted to highlight from the findings was the issue, the overarching issue of poverty. And there, the overwhelming majority of countries expressed their continuing commitment to eradicating poverty through income generation and employment opportunities. However, looking at the data, it is clear that there are persistent inequalities in wealth, and I think this was mentioned earlier in the presentation. Now, that inequality, in some cases, is pretty wide, and would continue to have an impact on the choices that people make and the way we respond to the challenges in improving the lives of people. So this is an area where we need to pay considerable attention. Now, on the issue of gender equality, nearly all the countries that responded recognized the importance of women's full participation in the formal and informal economy. And it was the same with women's participation in governance. Now, when you look at the flip side, in terms of engaging men and boys to promote male participation and equal sharing of responsibilities, less than 2/3 of countries express commitment to this objective. I think one of the things that was clear from the data is that a lot more work needs to be done with respect to women in rural areas, to improving the welfare of the girl child, especially in regards to health, nutrition, and education. Now, of all the ICPD-related issues in the global survey, ending gender-based violence was among the issues to which governments expressed the highest commitment. But again, we know from the data that this is one of the most massive violation of human rights today. And so that also remains a major area for work to be done. Now, you can see the percentage of countries that expressed commitment in the different areas for addressing equality in work and family life. Very high proportion against discrimination of women in the workplace, much lower commitment to work and family balance. And I think there was the question of paternal role in raising children was raised earlier. And of course, breastfeeding in the public workplace, much, much lower. But when you look at the countries where commitment was expressed to all these 5 policies, the figure then drops to below 20%, which means that there's a lot of work to be done. Now, with respect to young people, it is clear from the evidence that, especially in terms of the developing countries where many of the countries are expecting or are currently experiencing a youth bulge, that the kinds of investments that are needed to benefit from the demographic dividend still fall short. And even though many countries expressed support for job creation and access to sexual and reproductive health services, a lot of work needs to be done, looking at the data from different sources. Now, obviously, there's a lot of interest in addressing violence, exploitation, and abuse of young people. And there was commitment to instituting concrete mechanisms to ensure the participation of young people. Of course, the question of poverty among young people was also of concern, but the commitment to that was much lower. I think one of the striking things about the data was how little attention is paid to out-of-school youth. And that is an issue that I believe countries have to address strongly in this review. Child marriage is one of the blights on our civilization. And it is true that many countries, 150, have implemented laws to increase the legal age of marriage to 18 years. But in many parts of the world, girls are still married at much, much lower ages with, huge health outcomes, poverty, and so on and so forth. And that is one of the issues of the violation, again, of human rights. And the question of how you raise the status of women and girls in society, that needs to be addressed. Now, in the second bullet, we refer to 41 priority countries in which marriage before the age of 15 affects more than 30% of girls. But of course, again, there is a commitment to address this issue, except that some countries are more successful in tackling the issue than others. And we have evidence on the kinds of measures that can lead to successful policies in this area. Now, I think the important point to make about older persons and aging is the recognition of the importance of aging to the development agenda. And in fact, even in the countries where aging has not risen to the levels that you see in Europe and parts of Asia, there was still commitment to address the issues of aging, or at least to think through the kinds of policies that will be required to deal with them. Now, on discrimination, countries made or expressed their commitment to address different issues of discrimination, including with regard to older people and widows, especially. One of the interesting things was the policies of exclusion related to pregnant schoolgirls. And in many parts of the world, pregnant schoolgirls are dropped out of school or are not allowed to continue schooling. And the sad thing about that is that such exclusion actually reinforces the conditions that perpetuate unhealthy outcomes, both in terms of poverty eradication and health outcomes in general related to women and their children. You can see this slide, and in terms of the countries that address or commit to the 4 areas, it drops to 21.7%, pretty low in terms of commitment among countries. Now, the issues of sexual and reproductive health, again, have seen some of the greatest improvements in the way governments respond to that particular issue. And the slide provides, a picture of what governments are doing to respond to sexual and reproductive health. There are a number of issues, especially in Africa, where the provision of services continues to be pretty low. But I think the key thing is that 8 out of every 10 countries are committed to increasing access to comprehensive and reproductive health services. Now, the number drops when we come to persons with disabilities, indigenous people, and cultural minorities. Well, I believe that the data on abortion is pretty well known, and reference was made to it by my colleague from UNECE, so I'm not going to go into that. Again, reference was made to especially cervical cancer, but also to HIV screening. And the good news is the high commitment expressed by governments to address these issues. Urbanization and internal migration. Now, what the data showed is that many governments still feel that there is the need to restrain the movement of people from rural areas to urban areas. And yet the trend is towards greater urbanization. And the expectation is that our world will become increasingly urban. And so the key issue there is proactive planning in order to ensure that services are available and that urban areas actually become centers for economic growth and well-being for citizens. Whereas there is also the need to ensure that those who live in rural areas are covered by such services. International migration, there was substantial reference to international migration, so I will not go into it, but certainly international migration is one of the most important features of our present time, and it promises to be a huge part of the development picture going forward. I think one of the interesting things about international migration is that, now countries, whether in the developed or developing countries, are becoming both sending and receiving countries when it comes to international migration. One of the key things that the survey showed, and I believe my colleague Kwabena spoke about this, is the need to look at sustainability from a perspective that recognizes the importance of human rights, but the need to then look at the issue of innovation and in a way that enables us to move beyond focusing on numbers, but in fact to look at sustainable patterns of consumption and production in a way that enables those that are less well off to also increase their levels of income and well-being, but at the same time ensure that we are able to use the resources of the earth in a way that responds to the needs of everyone in society. So essentially, we do have a rich body of data which is still being analyzed. And based on the outcomes of the regional conferences and the thematic conferences, all these will be brought together into the global report to present the picture of the world as it is today and the kinds of interventions that government and people need to make in order to assure well-being to everyone. I thank you.
I thank the Executive Coordinator of the ICPD Beyond 2014 Secretariat for this informative overview, which puts our own regional survey in a global context. Now, that gives us now a little less than half an hour that I would like to use and give the floor to participants to comment on the findings of the regional report. There has been an advance subscription for intervention, which was opened to the government delegations as well as other participants as from 11th of June. The Secretariat posted and updated the subscription list on the conference website. For this high-level session, we have accepted 5 subscriptions only. Let me ask you for your understanding that it will be the policy during this conference to limit the interventions to 5 minutes. This 5-minute rule will also be applied for the thematic sessions where we have more time, but it will allow us to have more interventions and more participants in the debate. We have a traffic light system installed, which will help you when you have your intervention and give you a feeling when you should perhaps wrap up and give the time and give the floor to your next speaker. On the list of subscriptions, I have as first speaker in this session, in this morning, Sweden. May I give the floor to the Delegation of Sweden.
Thank you, Chair. Let me begin by thanking UNFPA and UNECE for arranging this conference and for the presentations of ICPD implementation in the UNECE region. I'd like to in particular thank the youth representatives for their excellent statement, which was most welcome, and let me reassure you that we are prepared to work hard to not disappoint you. Sweden was one of the pioneers at the outset of the ICPD agenda, and our commitment and engagement to develop this agenda continues. The ICPD agenda is of absolute priority to Sweden. We have strong hopes that this conference will contribute to identify gaps in implementation, emerging trends, as well as give strong and relevant recommendations for the future, both in the context of the ICPD beyond 2014 and the broader post-2015 development agenda. The ICPD agenda was groundbreaking in that it redefined population issues from the perspectives of the empowerment of women, empowerment and human rights of individuals, particularly the human rights and reproductive rights of women and girls. We must treasure and defend these fundamental principles, and they are also a prerequisite in our continued efforts for development. Mr. Chairperson, many important achievements have been reported in relation to the ICPD agenda from the member states in the region. We believe this is encouraging, but we also recognize that we all have continued work to do to fulfill our commitments in this regard. I would like to focus on one of the absolute key aspects of the ICPD, sexual and reproductive health and rights. The report shows that the UNECE region has seen many positive developments related to this since 1994. However, there is still an unmet need for contraceptives. Disadvantaged populations lack equal access to sexual and reproductive health services, including for HIV/AIDS. Access to safe abortions, as well as prevention and management of the consequences of unsafe abortions, is inadequate in many parts of Europe. Sexual and reproductive health and rights is a cross-cutting issue which affects the individual lives of women and men, girls and boys, as well as the development of communities and societies. It is also a fundamental aspect of increasing equality between men and women. Every woman and man must have access to sexual and reproductive health services, information and commodities, such as access to modern contraceptives, including emergency contraception, sexuality education, and safe and legal abortions. We must all work harder to accelerate progress in these areas. The rights and choices of the individual must remain the focus of our efforts to promote sexual and reproductive health. Policies must be non-discriminatory and evidence-based, and legal and financial barriers must be reduced. The ICPD agenda also addresses the needs and rights of adolescents and youth. The young are our future, and we need to nurture their interest and engagement so they can contribute to inclusive and sustainable development. Young people's rights to meaningful participation, to high-quality education, and to the highest attainable standard of health, including sexual and reproductive health, must be ensured. Young people must be provided with evidence-based comprehensive sexuality education and services that empower them to make informed decisions. This must be strengthened in our region, both in and out of school. We also need to reach out with and make easily available information on good examples and lessons learned in order for us to be as effective as possible in our work to fulfill the commitments made in Cairo. Mr. Chairperson, in closing, I would like to restate that the Swedish commitment to further the ICPD agenda continues. In order to contribute to the ICPD review as well as to the broader post-2015 discussions, the Swedish Parliament is hosting the International Parliamentarians Conference on ICPD Implementation, IPCI, in April next year. We have strong hopes that the IPCI conference, like this one, will provide an opportunity to mobilize political support around the world for population and development issues, including sexual and reproductive health and rights for all. I thank you.
Thank you, Sweden, and thank you also for the effective time use. I may now give the floor to the next speaker on my list, which is Finland. Please, you have the floor, sir.
Mr. Chair, distinguished delegates, let me first congratulate you on your election to chair this meeting and thank UNECE and UNFPA for organizing this meeting and the speakers for their excellent, interesting and informative interventions. Finland, as several other countries in Europe, has always been a strong supporter of the 1994 ICPD Programme of Action, advocating its goals and targets and the key actions for its further implementation in the international arena as well as in our own development policy. Looking also forward to the debates on post-2015 agenda and the Sustainable Development Goals, we believe that sexual and reproductive health and rights need to be kept high on the international development agenda. Finland is committed to promoting human rights and working actively against multiple forms of discrimination. Our current development policy is based on the respect for and the promotion of human rights. We focus our attention on minorities and groups whose rights are infringed, including women, young people, children, ethnic and sexual minorities, indigenous peoples, persons with disability, and people living with HIV. Difference in gender identity and sexual orientation or any other status does not and should not mean difference in human rights. Finland funds support networks and human rights organizations which defend the rights of lesbian, gay, bisexual, trans, and intersex people, and work for marginalized LGBTI persons and groups. Young people are the most important resource for sustainable growth. Investments in young people's education, health, and employment yield large returns. When young people know and understand their rights to healthy life, education, and training, and decent work, and when these rights are materialized, the development in our world can take a positive turn. Comprehensive sexuality education and information is crucial in empowering young women and men to sound choices, dispelling myths and sexual stereotypes, promoting equitable gender norms, as well as to reducing discrimination and sexual abuse and violence. Best results have been achieved when comprehensive sexuality education is curriculum-based and supported by relevant policies and/or guidelines. Our country has been considered as a model in reproductive health and education. This has needed enlightened political decision-making, the integration of sexuality education into general curriculum, and access to sexual health services, especially tailored for the young. As an outcome, we have seen, on one hand, reduced incidence of teenage pregnancies and abortions, and on the other, no increase in promiscuity. Nevertheless, also we have challenges. The global survey, ICPD Beyond 2014, shows that we need to increase the emphasis on sexual orientation and gender diversity in our programs. But we need also effective partnerships. In Finland, the non-governmental organizations are significant sexual and reproductive health service providers. Most often, pioneering in innovative ways to provide services to vulnerable groups such as sexual minorities and sex workers. Mr. Chair, we hope that the discussions at this conference and later at the ICPD +20 debates will contribute to enhancing the quality of life of all peoples and benefit future generations. Finland remains a strong supporter of work in this area. Thank you.
Thank you, Finland, and thank you for your important remarks. And again, congratulations for keeping within the given time. I have now the honor to ask Romania to take the floor.
Thank you, Mr. Chairman. Dear participants, I would like to give to you some information about maternal health in Romania in the last 20 years. When the Cairo ICPD conference was taking place, Romania was in a crucial point of reproductive service reform. After 20 years of pronatalist forced policy, under the population pressure, the abortion was legalized by the new government. The past policy, which prohibited abortion, family planning, and access to contraceptives, lead to a record number of maternal deaths caused by illegal abortion and the highest maternal mortality rate in Europe. You can see on the slide the red line. By the new legislation, the maternal mortality rate fell by half in 1 year, but the number of demand abortion exploded in the first year, were recorded about 1 billion abortion, approximately 3 abortions for every birth. In the first 3 years after the abortion was legalized, only some NGOs and gynecologists provided family planning services. There were not enough contraceptives on the market and not enough information, especially in the rural areas. The prevalence of modern contraceptives rate was only 10%. The abortion was practically the most popular method of fertility regulation. In 1994, the Romanian government was approving a well-structured national family planning program with technical and financial support from the World Bank, UNFPA, USAID, and UNICEF. The program was based on the 5 main pillars: establishment of a network of reproductive health services, initially in urban areas. Next slide, please. And later expanded to rural. Next, please. Training of healthcare providers, which covered in 4 years all over the country. Development of guidelines and standards for practice. Information and awareness raising program. Initially, subvention of contraceptives, and from 1999, free of charge contraceptive distribution from vulnerable population, unemployed, no income, women in social protection, students, and so on. This last measure involved a major financial effort of the government, but lead to a rapid growth of users of modern method of contraception. Next slide, please. Results were coming in time. Increasing number of modern contraception users in parallel with a decreasing number of abortion and maternal mortality. According to the latest survey in 2007, contraceptive prevalence in Romania is above 70%, and the modern contraceptive prevalence is above 61%, red columns. Also, induced abortion rate fall from 163 per 1,000 women in 1990 to 10 in 2010, and related maternal mortality rate from 147 per 100,000 live births in 1989 to 1.5 in 2012. We are thinking that Romania mostly succeeds to replace abortion as a main method of fertility regulation with modern contraception and met earlier 5 objectives of MDG. This is the result of establishment of a network of family planning services, training of providers, and distribution free of charge of contraceptive, and second, most important, the well-managed cooperation among government, public institutions, NGO, international organizations, UNFPA, USAID, and UNICEF. Romania, thanks to this international organization, in particular to UNFPA, to helping Romania to implement family planning program. It's important to note that after a drop from 2.2 in 89 to 1.4 in 93, the total fertility rate in Romania remained constant in the last 20 years despite the impressive rise in contraceptive prevalence. Romania may be seen an example on how shift in family planning policy may lead to important changes in reproductive outcomes. Firstly, restricting access to safe abortion caused a dramatic increase in maternal mortality due by unsafe abortion. And second, increased access to modern contraception has reduced the number of abortions and lowered the maternal mortality without reducing the fertility. Thank you very much for your attention.
I thank Romania for this very illustrative national example. I may now proceed to the next speaker on my list,